We're thrilled to have you with us. I'd like to take a moment to acknowledge that this webinar is part of a climate resiliency webinar series made possible through the support of the Maine Primary Care Association. We are also grateful for the funding support from the Qualidime Fellowship in Healthcare Quality offered through the Maine Public Health Association. Their support has been instrumental in bringing this educational series to you. Also, a big thank you to the Migrant Clinicians Network for the amazing support they've provided. Before we dive into the content, I have a few housekeeping items to share. The first,
I lost
Perdimos a Leslie.
We
Yes.
lost Leslie.
Leslie, ¿nos escuchas?
Leslie, can you hear us? We lost you.
Bueno, pienso que una de esas logísticas
I
que
think
Leslie estaba mencionando
some of
es
the
una
housekeeping
encuesta,
things she was
¿ustedes lo
mentioning
último,
is a
Leslie?
survey. Oh, Leslie, you're back.
yeah. Oh, did it freeze? I'm so sorry.
Sí, por favor, continúa.
Please continue.
Okay. The second housekeeping item is that we'd like to gauge your current knowledge of today's topic, so we will launch a quick one-question poll. As people fill out the poll, I can continue on. So lastly, this webinar will be available on the Maine Primary Care Association, Maine Public Health Association, and Migrant Clinician Network's websites. So if you want to revisit any part of today's session or share it with colleagues, you will soon be able to access the recording. I'd like to introduce our speaker for today, Elma Galvan. She's the Director of Community Engagement and Worker Training with MCN. Bicultural and bilingual, Alma has worked for more than 3 decades to improve the health of communities disadvantaged by structural inequities in the United States, Mexico, Puerto Rico, and Latin America. Her work has focused on a broad range of public health topics, including infectious diseases, environmental health and justice, climate justice, worker health and safety, drug prevention, water and sanitation, cultural competency, and community development, water and sanitation. Alma has extensive expertise in providing technical assistance and developing culturally contextual curricula and educational materials for limited English proficiency and low literacy adult learners, community health workers, health professionals, health educators, and clinicians. Her unique approach to adult learning and expansive expertise in community-based approaches to health promotion helped hundreds of community health workers, clinicians, and health department personnel bring culturally contextual COVID-19 resources and strategies to immigrant and migrant communities in order to promote vaccination and address misinformation. Elma has worked extensively with MCN partners, community-based organizations, health agencies, and local and state health departments promoting health equity through language access and cultural competency. So without further ado, Alma, I'll hand it over to you.
Thank you, Leslie. I'm so happy to be here. And please allow some time for interpretation to switch to Spanish as the first language. I will give just a minute and I will. En un minuto más empiezo.
I'll start in a minute.
Bueno. Creo que estamos listos.
I think we're ready.
Muy buenos
Well,
días,
good
muy buenas tardes a
afternoon,
todas y a todos ustedes.
everyone
Muy contenta de
here.
estar
I'm so
aquí
happy to
y
be
el día
here
de
with
hoy voy
y'all
a hablar un
today.
poco
I'm going
sobre
to
nuestro
talk a little bit
trabajo
about our
en la
work
comunidad migrante
with
y
the
la
migrant
educación.
community and
Y cómo se
education,
relaciona con el
and
trabajo
because
que,
it
que
is
desarrollamos.
related to the work and how it relates
Primero
to the
quiero
work you do.
presentarles
First,
a
I want to
Migrant
introduce
Clinicians
you
Network,
Migrant
la red de
Clinicians Network with
proveedores de servicios de salud para migrantes.
it's a
Nosotros
network of
estamos
health service providers for
trabajando
migrants. We work
bastante hacia
hardly
promover la
to
equidad en salud y
promote
trabajamos
health
con
equity,
valores
and we
muy,
work
muy
with
grandes relacionados
very
con la
important
justicia y la
values related
igualdad
to justice,
y
equity.
pensamos
And we
realmente que la
think
migración no
that
debe ser un
migration
impedimento
should
para
not be
esta
an
calidad
obstacle, a
de
barrier to being
emergencia.
healthy and
Este es
having
parte de lo que hemos
wellness.
estado
This is
haciendo
part
por
of what
más de
we've been doing
40
for over
años
40
y
years
nuestro
now. And
trabajo
our work
va dirigido a
is
diferentes
aimed at
cuestiones,
different
desde el desarrollo de
issues, from
recursos,
resource
educación
development,
directa a
education,
proveedores de servicios de salud,
directly to health
asistencia
service
técnica a
providers,
los centros
technical
de salud,
assistance to health
agencias
centers,
o organizaciones no
agencies, or
gubernamentales,
NGOs,
investigación en salud,
research in
manejo de
health,
casos,
bridge case
también
management.
sobre la salud
We
y
also
seguridad de los
work on worker
trabajadores, un
health
área
and
que trabajamos
safety.
bastante,
That's something that we work a
evaluación y
lot
advocacy. Y
in
bueno,
evaluation
estamos
and
a nivel nacional,
advocacy.
estamos,
We are at a
yo estoy
national
hablando desde
level.
New
I
York, desde
am speaking to
Massachusetts,
you from
cerca de donde ustedes
Massachusetts,
están, pero
very
tenemos
close to where
nuestra
you
oficina
are, but we
central
have our
en
main
Boston.
office in
Marta, que
Austin.
nos acompaña,
Marta,
está
who's
desde
here with
Nueva
us
York.
today, is joining
Y
us
el
from
día de
California.
hoy
And
voy a hablarles
today I'm
con
going to
ustedes y
talk with
compartir con
you. I'm going to
ustedes
share with
nuestra
you
experiencia
our
en tres cosas
experience
muy
on three
sencillas,
very
¿no?
simple
Cómo el cambio
things.
climático
How
está
climate
impactando la
change is
migración y a los
impacting
migrantes y
migration,
a los
migrants,
sistemas de
and
salud
health
donde ustedes
systems
trabajan.
where you
Número dos,
work. Number
discutir
two,
cuáles
we're going to discuss
estrategias de
public health
salud pública
strategies
son
are
importantes para poder llegar
important
a esta
to
población migrante
reach
y
this
población en general.
migrant
Y por
populations,
último,
this
hablar
underserved
del
populations. And
papel de las
lastly, talk
promotoras
about the
y los
role of
promotores de
community health
salud
workers
comunitarios en el apoyo a
and
esta
what they can do
emergencia.
in supporting migrant
Bueno, para
communities.
hablarles de
And
esto
to talk
necesitamos
about
hacer
this, we
algunas
need
consideraciones
to
y
take
empezaré con
some considerations. And I'm going to
considerarles
start with a
de
very general
quiénes son estos
overview of
migrantes,
who
quiénes
are
son
these
estas
migrants,
personas
who are
a las que
these
nosotros
people
estamos tratando de
that
llegar
we're
a
trying
posicionar.
to approach or provide
Resulta
services for.
que en los
Well, the
Estados
thing is
Unidos
that in
hay
the US, we have
333 personas viviendo en este país.
333
De
million
esos,
people living in this country. Of
46.2
those,
son migrantes.
46.2
Esto
million are
representa casi el
immigrants. They represent
14% de
almost
la población
14% of
de este
the
país.
population of this
Y
country.
estos migrantes, el
And these migrants,
52% de ellos son de
52%
América,
come
de
from
este
America,
continente.
from this continent.
31% vienen del
31% come from
el
Asia.
continente asiático. Y bueno, no voy a
And
entrar
I'm not
mucho en
going
toda la
to go into
cuestión de
much
las
details of
visas y
visas
cómo
and
opera este
how
sistema
what is the
de
system,
migración
the
dentro de los
immigration
Estados
system
Unidos.
within
Lo
the
que es
US. What
importante
is
para
important
nosotros es
for
de
us is
más o
that
menos en
more
este
or
país
less in
hay
this country we
11
have
millones de
11
inmigrantes que
million
no tienen documentos
unauthorized
para trabajar en
immigrants,
los
immigrants
Estados
that do not
Unidos.
have
Eso
documents,
es
work
un
permits to work in the
78
US.
más o
Of
menos
those,
por ciento, son
78%
de
more or
América
less are
Latina
from Latin
y el
America
Caribe.
and the Caribbean.
Entonces, ¿cómo se
So
distribuyen
how is this
nuestros
distributed? How is this population distributed?
45% son
45%
mexicanos,
come from
nativos
Mexico or
mexicanos,
Mexican,
el
Mexican
4%
origin,
más o menos
4%
son
more or
de
less
caribeños,
are
el
from the
20%
Caribbean,
de Centroamérica y
20% from Central
11%
America,
de
and
Sudamérica.
11% from
¿Qué
South
nos dice
America.
todo esto?
What does this
Tenemos que
tell
pensar
you? That we
en
need
el
to
lenguaje que
think
ellos
in the
usan
language they
y en qué
use
es cómo
and
ellos piensan.
how they think.
Significa entonces
That
que,
means then
fíjense nada más,
that
de
look at
estos
this, of this
46.2 millones de
46.2
inmigrantes a los
million
Estados
immigrants
Unidos,
in the US,
más del
over
70% de ellos,
70% of them,
más del
over
70% de ellos
70% of them
ocupan o están
are
trabajando en lo que le
working in
llaman
what are
trabajos
called
esenciales. Y esto
essential
tiene mucha
jobs.
relevancia
And this
para
is very
hacia el
relevant
trabajo.
to our work.
Esta es una pena que no se
This
vea
is,
tan grande,
I'm sorry, this is
pero van
so
a poder
small
ver
to
con
look at, but you'll be
pantalla
able to see
agilada.
this in detail when
Es
you receive the presentation.
una
This is a
fotografía de dónde
picture of
trabajan los
where
migrantes dentro de los
immigrants
Estados
work
Unidos.
within
En el
the
caso de
UN,
Maine,
the US.
los
And this in Maine,
inmigrantes
immigrants
registrados o que tienen
registered
documentos para
that
trabajar
have
están
work
como en
permits are work as teachers, more or less. But in most of the rest of the states, they work in agriculture, transportation, construction, services, and kitchens, no cooking. What does this mean? Well, we have to break down a little bit, like flesh out what is an essential worker. Or essential workers in the US are those people that work in agriculture, that work in the processing of meat and food, whether it's seafood, meat, or chicken. People that work in dairies, there's a lot in Maine. Construction workers, all the people that work in grocery stores, and health workers. Those are essential workers. And if you can realize this, then a lot of these workers are the ones we just saw. So how do we relate climate change to migration and health? We need to realize that people at the moment are migrating as a result of climate change. It's estimated that by 2050, we're going to have over 200 million people that will be displaced or will be migrating because of climate change and all the risks involved. In order to explain this to you, I brought this slide. It's a little saturated with text. We're trying to simplify it, but the important thing about this slide is that we can see all the dangers or risks or climatic dangers or risks to the left. Like we can see the heat waves, droughts, wildfires, floods, sea level rise, and tropical storms that we are seeing with much more frequency and strength, of course. And this changes the landscape where we live. There's more deforestation, there's less trees, there's more desert, there's less water, there's more soil degradation, infrastructure damage because of these storms and natural events that we see. There's damage to vegetation and many other things that will modify or change health determinants. What are those health determinants? Those are the ones that you and us know very well, like pollution, air quality, increased temperature, water scarcity and contamination, hygiene, sanitation, migration, loss of livelihood, because face these events and they're gonna die. They damage the lands where agricultural workers work. So these the health determinants by themselves will modify or create more respiratory diseases, more cardiovascular diseases, more infectious diseases, malnutrition, heat-related diseases, death, heat-related deaths, and many other risks and deaths related to to job risk.
So when you see the slide, you will be able to see that a heat wave, for instance, is going to lead to soil degradation, infrastructure damage, and also is going to lead to many diseases. You will see how those are linked. Finally, we consider health not only as the physical health, but also mental health. And this is something that we need to really keep in mind when we approach these migrant communities. Why? Because they're in the middle. You can see the displacement and migration is in the middle of all this set of factors that will impact people's health. What does this mean for migrants, people who are migrating to the US? This climate crisis is driving migration. This migration is dangerous. There are extreme temperatures crossing to the US that they work in
nos necesitan ciertos
works
documentos y
that
son
they
trabajos
need
riesgosos, trabajos al
uh,
aire libre,
in
trabajos donde
risky
están
jobs,
expuestos a las
or
temperaturas
where
y
they
a
are exposed
condiciones
to
de trabajo
temperature
difíciles.
and
Y por último, pues
and
viven en
very hard
lugares y
conditions on
tiendas
the
vulnerables. ¿Por qué?
in the
Pues
and then
tiene
they
que
are
ver
also
con lo que
vulnerable
se,
communities.
lo que se
Why?
gana o lo que ellos
Because with
ganan,
whatever they
además se
make,
ponen o se establecen en
they
lugares que
they
son
settle
de riesgo,
in
donde puede
risk
haber
areas
más
where
incendios
where
forestales, que
you
están
can
más
find
propensos
more
a
wildfires.
las
They are more vulnerable
inundaciones, a
to
los
flood,
huracanes y por supuesto
hurricanes,
al calor.
and of course the heat.
Bueno, esto es complicado, ¿verdad?
This is
Pero es muy
complicated, right?
importante porque
But it is
nosotros
very
servimos
important
a
because
este
we
tipo de
serve this
personas,
type of people.
nosotros mismos somos
We
inmigrantes, yo misma soy
we ourselves
inmigrante,
are migrants. I myself
y
am
con
an
una
immigrant,
probabilidad de muerte mucho
and
mayor.
the
Si usted
the
es
risk of death
inmigrante
is
o
much
si usted
higher if
trabaja en
you are an
agricultura o
immigrant
si
or if
usted
you're a
trabaja
migrant,
en
if
la
you work in
construcción.
agriculture
En
or
general, ¿sí?
construction.
Nosotros tenemos un riesgo de trabajo
So in
siempre mayor
general, the average
de
risk
morir por enfermedades relacionadas por el
to
calor.
die
En
in
cambio,
heat
un
related
trabajador de la
disease
construcción
is much higher.
tiene 13 veces más
Construction
riesgo
workers
de sufrir
has
una
13
enfermedad
times
relacionada
more
con el calor.
chances
Y aún más, los
of
trabajadores
a
agrícolas tienen
of having a
35% más
disease
probabilidades de morir
and
por una enfermedad
to die
relacionada con el calor
for a disease
en
related to for a
comparación
condition related
con
to heat,
un
and
trabajador
agricultural
honesto.
workers 35
Esto es
times more
bastante, ¿verdad?
chances to
Bastante.
die
Y
for
estos son
a
datos
disease
del hoy.
a heat related disease
Y bueno,
than the regular people.
la cuestión aquí es que
And
tenemos que hablar de la
here we need
migración,
to
de
talk
los
about
trabajadores
migration
esenciales y de
and
quiénes
essential
son más
workers,
vulnerables
who are the
con
most
todos estos
vulnerable
riesgos que
with
implica
all
el
these
cambio climático.
risks that are
Los que
related
son más
to climate
vulnerables son
change.
estas personas que trabajan
Uh,
al aire libre,
those
que
who are
tienen un
more
nivel
vulnerable are the
socioeconómico
people
más bajo,
who
que
work
ganan menos,
outdoors, who have
los niños, por
lower
supuesto, los adultos
lower
mayores, las
wages,
personas
and
embarazadas
the
y todas
elderly,
aquellas
pregnant
personas
people,
que
and
tienen
everyone
enfermedades
who
crónicas. Y
suffers
de
chronic
rigor, los
diseases,
migrantes, ¿verdad?
and
Por todas
also
las cosas que
migrants,
nosotros ya
because
vimos.
of the things that we have
Y
already
aquí
looked
en
into.
este país hay
And here in
una
this
paradoja,
country, there
¿verdad?
is
De
a
que
paradox
estos trabajadores a su vez
that
son esenciales, pero
these
son los más
workers at the same
vulnerables. ¿Por
time
qué?
are
Porque
essential
no
and they
tienen
are vulnerable.
acceso
Why?
a
Because they don't have
servicios
access
médicos,
to
no
medical
tienen
services.
aseguranza médica.
They don't have
El
health
sistema,
insurance.
la
The
estructura, los
system, the
hace más
structures
vulnerables. Es
make
algo que
them
tenemos que
vulnerable.
trabajar a largo
And this
plazo,
is
¿no?
something that
¿Cómo
we have to work in the
mejoramos
long
los
haul?
sistemas para
How
que
do we
apoyen a las
improve the
personas que
system so
están trabajando
they
en
can
este
support
país?
the people
Y
who are
bueno,
working in this
otra de
country?
las grandes
And
cosas que sucede
well,
con ellos es que
one of the things
trabajan
that happens is that
por su pago,
they
no tienen
work
tiempo para irse a poner
independently.
una
They don't
vacuna,
have
a
time
tener servicios
to get
preventivos
a
o,
vaccination or
por
preventive
ejemplo,
health
pago
care,
de trabajo por enfermedad,
and
¿no?
the
Si están
lack of
enfermos,
paid
pueden
sick
dejar
leave.
de
If they
trabajar
are
siempre.
ill, they have
Entonces,
to still to
son
work.
muchas cosas que nosotros tenemos
So these
que
are there
considerar.
are many
Y
factors that
tenemos
we need to
también que tener
consider,
en
and we
cuenta
also
que
need to consider that
esos son los factores
those
externos
are
del
the
impacto.
external factors,
Hay otros factores
but
como
there
por
are
ejemplo las
also other
diferencias
factors.
lingüísticas
For
y
instance, the cultural
tradiciones que tenemos,
and
¿no? Los
linguistic
diferentes
differences.
migrantes. No podemos decir
We
que
cannot
todos
say that
hablan
all
español porque hay
speak
muchos
Spanish because
diferentes tipos de español
there
y
are
venimos de diferentes
many
países.
types of
Entonces hay
Spanish and
muchas
we come from
diferencias
different countries. So
culturales
there are many
y
cultural
lingüísticas,
differences
¿verdad?
and linguistic.
Además, se tiende a que
Uh,
como trabajan en el
Not
campo o
only
trabajan
that,
en la
but
construcción,
since they
viven
work
en
in
áreas
in
rurales,
agriculture
viven en
and in construction,
construcciones
they live in
donde
rural
viven
areas.
hacinados o mucha gente que
They
vive
live
en ese
in
lugar, ¿no?
crowded
Entonces,
housing.
pues no hay muchas
So
políticas que
there are
los
not really
protejan.
policies that
Con el
really
calor,
protect them.
ahorita ustedes se dan
With the
cuenta que hay
heat, as
muy
you can
pocos
see,
estados
there are very
que
few
tienen un
states that
estándar de
have
calor. Y ahorita en
heat
este momento a
standards.
nivel nacional ya se
N-
está tratando de
Now,
poner un estándar
currently at
de
the federal
protección
level,
para
they are
nosotros.
working
¿Por
in
qué?
setting
Porque el calor
a
está
heat
terrible.
standards for
Entonces,
heat.
todo esto más
So this plus the lack of immigration status, the, n- n- their mobility, they are going from one place to another, especially temporary migrant workers that are starting in Florida and then go north until Maine, looking for work, Vermont, and all these places.
Eso implica
So that means
todavía más
that
condiciones que
there are
los hacen
more
vulnerables.
conditions that bring more conditions
Bueno,
that makes them
¿qué
vulnerable.
vimos? Por una parte,
So
toda
we
la
saw,
cuestión de la
on the one
migración,
hand,
las
the
condiciones
migration, the
que los hacen más
conditions,
vulnerables.
and what makes them
Pero
more
también
vulnerable.
tengo
But
que hablar
also, I have
de
to
otra
talk about
condición que es muy
another
importante para
condition that is
nosotros.
also very relevant for
¿Cuál es
us.
el
What
promedio
is
de
the
escolaridad?
what
¿Cuál
is the
es el nivel de
literacy, the current
alfabetización de
rate and
las
literacy
personas?
rate of
Este
these
mapa que
people?
ustedes
This
están
map
viendo
that you
ahí
are looking at
les da una fotografía
gives you a
de cuál es el
picture
promedio de escolaridad
of
que la
the
encuesta es
average of
MIS, ¿sí?
a
Y cuál es la
school
tasa de
rate and
alfabetización
the
que es
literacy
TA,
rate,
¿sí?
EA.
Si ustedes ven, Estados
If you
Unidos, por ejemplo,
see
tiene
the
el
US,
promedio de la
the
población
average
tiene 13 años de
has
escolaridad
13 years
y un
of schooling
99%, que
rate,
es la tasa de
and
alfabetización, sabe leer y
99%
escribir.
of
¿Ve?
the people
Aquí está
know how to
definido
read
qué
and
es
write.
MIS y qué es TA.
So that's
Entonces,
T
fíjense con diferentes
MIS
cosas. En otros países como
and
México, donde viene
TA.
mucha de esta
Other
población,
countries like
9 años
Mexico,
es el promedio de
the
escolaridad. ¿Sí?
the
Solamente el
MIS is
94% de la población sabe
it
leer y
is
escribir.
9
En
years,
India,
and only
vamos a la India,
94%
también tenemos
of
mucho flujo
people know how to read and write. And in
el continente asiático.
India,
En India hay 7 años de promedio de
the
escolaridad y
average
un
schooling rate is 7
72%
years,
de
and 72%
alfabetización, gente que sabe
of
leer y escribir.
people have the
Haití,
literacy rate is
tenemos mucha gente de
72%.
Haití que está
Haiti, we
llegando.
have many people of
6
Haiti
años
that are coming.
promedio
And
de
the
educación
average
y
schooling rate is 6 years, and
solamente 60%
only
sabe leer y
60%
escribir en su
of
propia
them
lengua.
know
¿Sí? Y
to read and
también
write in
son
their own
Guatemala, de
language.
donde viene
And
también
let's finish
bastante
with
comunidad.
Guatemala,
En Guatemala son
where that it
7
is also
años
sending many people.
y es
The
7
average
años el
schooling
promedio de
rate is
escolaridad
7
y
years, and
79% de las personas saben
79% of the
leer
people
y
know how to
escribir.
read and write.
¿Sí? Esto nos abre
So
un mundo
this
de
really
cosas en el
opens a
sentido de que
world
tenemos
of
que
things in
pensar
the sense that we
de
need
dónde
to
viene la
think
gente,
uh,
si sabe leer y
where the
escribir en
people
su
come
propio
from, if
idioma
they know
y
how to read and write
qué
in
tanto sabe
their
leer ese
native
idioma
language,
en este
and
país y
how
en otros
much they
países.
know the language
¿Qué es lo que significa
in
esto
that
para
country. What does that
nosotros?
mean
Y
for
por
us
favor, nos pueden
as
poner
healthcare
algo en el chat,
providers?
qué significa
What
estos
if you
factores
can
que
also please
estamos nosotros
share
hablando
us
para
in
el
the chat?
trabajo que
What does
nosotros
that
estamos
mean,
haciendo?
those factors for the work that we are doing?
Me dice Marta si hay algún
And
comentario por
Marta,
ahí.
can you please let me know if people are writing
Aún no.
with a comment?
Aún no. Bueno, sí, que el mensaje, dice Joe Rogers, que el mensaje
Joe,
no puede ser en
Joe Rogers
texto
says that
únicamente.
messaging
Bien,
cannot be text only.
esa es una de las cuestiones muy
Yes,
importantes.
that's something
Sí,
that it
Ana,
is
les
very
vamos a
important.
compartir el
So
taller.
we will
Voy a
be,
continuar entonces. Bueno, pues muy cierto, como
I
dice
will
Rogers,
continue.
tenemos
That is so
nosotros
true.
que crear
We need
materiales
to
educativos que sean
create culturally
adecuados,
appropriate
equivalentes,
educational
¿sí?
materials
Y apropiados para
and that are
estos
also that are
trabajadores o estas
appropriate for
comunidades a
these
los que
workers or
nosotros
these
queremos llegar.
communities that we want to
Lorena
reach.
nos dice que serían los
Lorena
parámetros
is
que
telling
dictan
us
cuál sería la
that
mejor
those are
manera
the
de comunicarnos con esta
parameters
población,
to
¿cierto?
is
Y
telling us that
significa que debemos utilizar
those will be the parameters
metodologías
that will
más
say
lúdicas y
the best way
participativas.
to
Totalmente de
communicate with this
acuerdo,
population,
Carmen.
that we
Vamos a hablar
use
sobre
more
eso. Sí,
uh,
entonces significa que tenemos
participatory
que crear materiales culturalmente
methodologies.
más adecuados. ¿Sí?
Yes, we need to
Y
have
una de las
culturally
primeras
appropriated
cosas es
materials.
el
And one of
lenguaje.
the
¿Sí?
first
Las
things
cosas
is
que tenemos que
language.
considerar es el
We
lenguaje.
need
El
to
lenguaje
consider
no
language.
solamente que
Language
hablan
is not
español,
just that they
sino de
speak
dónde
Spanish,
vienen, cuál es
but
sus
where do they come
creencias,
from?
cuáles
What
son
are
sus
their traditions,
tradiciones. El
costumes?
lenguaje es una puerta de
Language is
entrada para
an
saber sus
entry
valores,
point to
esos
learn about their
alrededores, sus
values or
miedos, las
anti-values, their
condiciones
fears,
sociales
the
y las
social
dinámicas de
conditions, the
poder, si es
power
un hombre, si es una
dynamics,
mujer, o
if
si
it's a
es
man or a
adulto
woman,
mayor
if
o
it's
es un
an
joven.
elderly, or if it's very
¿A
young.
quién debemos de llegar si es una
Who
familia
should we
que viene
reach?
de
If it's a family
Guatemala,
that
así
comes
es
from
una familia
Guatemala,
que viene de la
or
India?
if it's a
¿Con quién
family
debemos
that
de
comes
llegar?
from India,
¿Quién va a ser
should
nuestra puerta de entrada en
should we
ese
approach? Who is going to be
Entonces,
your
no
entry
solamente el
point?
lenguaje hablado,
Not just
sino
the language,
todo lo que
but
conlleva el
uh,
lenguaje que nos
everything
está,
that has to do with
eh,
language
que ellos hablan, ¿no?
that they are speaking.
El otro punto muy
The
importante
other
es la
important issue
alfabetización. No
is
solamente saber leer y
literacy. It's
escribir,
not just about
sino
knowing how to read and
incluso la
write, but
alfabetización en salud,
literacy
¿sí?
in health,
La
health
alfabetización en
literacy.
salud es un
Health
concepto que
literacy
lo hablamos
is
muy
a
poco y
concept
a
that we
veces
discuss a
no lo
lot, but
entendemos
sometimes we
lo que
don't
sabemos.
completely
Yo voy a
understand.
compartir con
And I'm
ustedes
going to
parte de
share
lo
with
que
you
es
part
esta
of
alfabetización en
what
salud
this health literacy
eh,
is
en términos de que
in
es
terms of
podernos comunicar
it's about being able to
hablando,
communicate,
¿sí?
speaking,
Podernos comunicar
spoken
escribiendo, ¿sí?
communication, written
Poder
communication,
entender
we
los
being
números
able
y
to
las
understand
matemáticas
numbers
es muy
and
importante
math
para, por
because
ejemplo,
it's very
para
important
llamar o para ver
to
cuánto medicamento
call,
tenemos
to
que
see how
tomar,
much
etcétera.
medication we need to take,
Cómo
etc.
usar
How
esa
to
información,
use
no
that health
solamente
information.
dar la
It's
información,
not
sino
about just
cómo usar esa
providing it, but
información y
how to
cómo
use it
navegar
and
el
how
sistema
to
de salud.
navigate the
¿Sí?
health system.
Ahí es mucho donde nosotros a
That's
veces nos
where
perdemos,
we get
porque
lost a lot
pensamos que
sometimes
es nada
because we
más que
think that
nosotros
it's
nos
just about
comuniquemos con ellos
us
para
communicating
obtener
with
lo que queremos,
them, with the
sí, hacemos
population we are aiming
actividades
at, and
y
we prepare
nosotros lo
materials
entendemos
and
y
we
asimismo
understand them, and we
resolvemos.
don't know if they
Nos
understood it
olvidamos de
themselves.
la
And we
parte de cómo
forget
usan esta información y
about
si la
how they
dejan
use that
esta
information and
información.
if they're able to
Ustedes y
navigate
yo
the health
no me
system.
van a dejar
You and
mentir,
I, don't let me
que
lie,
de alguna manera trabajamos
uh,
en el
sort of
sistema de salud,
that we sort
no
of
es
work in the
fácil
health
navegar,
system,
no
it's
es
not
fácil hacer
easy to
comercio, no es
navigate it. It's not
fácil
easy to get
comunicarse, no es
appointments. It's
fácil
not
hablar
easy
con la
to
gente.
communicate
Ahora
and
imagínense
talk
alguien
to doctors.
que
Now imagine
en su
someone
propio idioma
that in their own
no tiene,
language maybe doesn't
no
have
maneja esta comunicación verbal, no
or
tiene la
doesn't
comunicación. Y
dominate
ahora en un idioma
spoken
nuevo, como
communication,
es el
doesn't
inglés, pues
understand this.
entonces
And in a new language like
ahora
English, well, it can be
hay dos
complicated.
tipos
So
de
there's two
alfabetización en
types
salud.
of leadership,
No
health
solamente de
literacy.
las personas
It's not just
con
about
las que usted va a
the
trabajar,
people that you're going to work
sino
with.
también
It's
usted
also
mismo.
your
Usted forma
own.
parte de una
You are part
organización.
of an
Usted forma
organization.
parte
You're
de
part
un
of
sistema
a
que,
system
si bien
that
nosotros siempre pensamos
we
que
we
las
always think
personas
that
deben de
people
comprender y
should
utilizar la información
understand
y
and use
navegar
the
el sistema,
information and navigate the
entonces tienen
system, and
alfabetización en salud.
then they have health
Nunca pensamos
literacy. We never
que
think
nosotros
that
como organización
us as
debemos de
organizations
permitir
should
de manera
allow
equitativa a las personas encontrar, comprender y utilizar
equitably,
datos.
we should allow
Ahí es
people to
donde muchas
equitably
veces nos
find, understand, and use the
fallamos y
information.
nosotros
That's where we
necesitamos
fail sometimes, and
trabajar.
we need to
¿Por
work
qué?
on this.
Porque
Why?
debemos, esa es
Because we
nuestra función,
should.
no
It's our
solamente dar el
function,
servicio de
not just
salud,
provide
sino
the
dar
health
los
service.
elementos para
We need
que
to
ellos
provide the elements
manejen la
for
información
them
que nosotros les damos.
to be able to
Que
handle the
justo
information that we
tomen
provide and
decisiones
that they feel
adecuadas,
comfortable and make
educadas
the
para
right
ellos
decision,
y para
educated
su
decisions for
familia y
themselves
para
and
las
for their
personas
families
cercanas.
and for the people in their
Entonces,
communities.
yo abogo mucho
So I
porque no
advocate a
solamente
lot
hablemos de
for
la
us to not just to
alfabetización de las
speak or
personas,
talk
sino
about
sino
uh,
nos
literacy in
revisemos
people,
nosotros
but
como
that we
organización y
also
veamos
look
si
at
nosotros
ourselves
estamos
as
hablando
organization
claro,
and see
si
if we are being
nosotros
clear
estamos
in our
hablando simple,
communications,
si
if we're
nosotros
if
hacemos las
we're
cosas
speaking in
claras
simple
y
terms,
entendibles para la
if we
gente.
make this
Y no
information
solamente
understandable
nosotros,
for
sino
people, and not
nuestro
just
equipo,
us, our
nuestro
team,
sistema.
our system.
Y es ahí donde
And
vamos a
that's
encontrar
where we're
una
gonna
gran brecha.
find
Una
a big
brecha que
gap,
nosotros
a gap
necesitamos
that we need
cerrar.
to work on to close.
Déjenme ver.
Let me see.
Entonces,
So,
pues, ¿cómo podemos hacer
so
eso?
how can
Pues
we
ya
do that?
me invitaron para
Right.
hablar un
Yeah, that's
poco
how,
sobre
that's why you
qué
invited
podemos
me
hacer para
to talk a
acercar
little bit
a
about what
las
we can do
personas
to
migrantes,
reach
teniendo en
migrant
cuenta la
people
migración
on taking into consideration
climática,
climate migration, what is happening in the country, and considering their educational skills. So there's several strategies, health promotion strategies, and I'm going to share what has worked really, really well for us at MCN. The first is to incorporate the community health worker as public health strategy. This is really important. There's still a lot of health centers that don't consider them, and we're going to talk a little bit more about that. But they have a fundamental role. The other is language justice. Please, please see what we're doing. We're talking about this in Spanish. Normally, these webinars are offered in English, and community health workers have to take what they learn and go to the community and translate it there. So sometimes there are things lost in translation because we don't have the language. So us as organizations, we need to provide the information in the language that the person will understand. And that means that if the doctor or community health worker are going to provide services in Spanish, in Haitian Creole, in Hindi, the information needs to be provided in that language. Support materials need to be provided in that language. The thing is, we have to provide the service in the language the person that we are serving prefers. Remember, it's about them, it's not about you. And unfortunately, we work based on ourselves and not based on the people we serve. So that's the other aspect. The other aspect is health equity. What does this mean? What does health equity mean for you? It means that we all have access, right, to services, right? Yes, that's what this means, that we have access regardless of their conditions or whether they have documents or they don't, where they have if they're migrants or not. That's what it's about. And I'm reading some of the comments that you've shared in the chat. The other thing is that one of you were saying in the chat is using popular education. It is super important. Participatory education, dynamic education, education where we can connect with what people know. That's why it's so important to know what their values are, their languages, if they come from Colombia or from Mexico or Guatemala. And not just what country they come from, but if they're coming from a specific place. So popular education allows us to talk to them, interact to them with them, sorry, so they can tell us and we can learn. It's a process of learning and teaching where you learn from them and they learn from you. It's not just the way we're used to prepare materials, provide materials, and it's their responsibility to learn. The other is super important. It's a strategy that has been used a lot in Latin American countries and in Asia as well. And it is community participation or mobilization, community mobilization. And I'm going to provide an example. It's a very clear example. All health centers have to have a emergency preparedness plan. All of them. If they don't have one, they are not given funds from HRSA. But you can ask the community if they know what is the plan in case of a disaster, and very few people know about it. And if you ask them if the community is involved, if the community knows what they need to do, very, very few times is the community involved. So the important part here is that for us to be able to have resilient systems, people that can move around and help when there's disasters or when there's disease, or to prevent, for instance, during the pandemic, or mitigate a situation after disaster, we have to have the participation of the community. They have their own networks, their own ways of moving about. And if you integrate them, involve them in the process, in the work plan, they're going to say, do things a lot better. Not when you necessarily at the times you expect them, but the best way possible. And remember, the community is the most important thing. That's why you're there, because of the community. That's who you serve. And we don't take them into consideration. So that's it's kind of a little weird, don't you think? But anyway, we're in the process of changing. Now let's talk. I already mentioned these are the 5 main strategies that we use. I'm going to speak very quickly about the first one. I know there's a lot of community health workers in this conversation. And so community health workers allow us to access and provide preventive primary health education services, case services. They help us a lot in health education. They can educate on any topic. And if they have the resources and they're trained and they have the language to go to the community, they can manage a case. And diabetes is very well documented, proven that the health team needs to have a community health worker, that can go and check in on the patients, see how they're doing, help in self-management. They also connect the community to social services, not just the community with the services, but you as well with organizations and health centers. You connect them with the community. So this community health workers need to be from the community itself. Why? So they can transmit, convey the information in a way that is culturally adequate. It fits somebody from the community. That's the best thing. And lastly, because they're part of the community, they very easily can advocate for what people want. So we need to have them sitting at the table. Community health worker is the liaison between the community and the health centers or the organizations that want to work with the communities. So we need to see their or revisit their role. They're not the employees that we call on when we need them. No, they need to be part of the main or the core group or the health team to manage cases. They are this trusted people that the community believes in, and many times they are part of the organization of the base grassroots organization. So in that sense, they help us to construct alliances with local entities. They know where the corner store is. They know where this man that's ill lives, or this lady that uses a wheelchair, and they can help us map where are the resources and where can we start. So as you can see, I'm a follower and I'm a fan of community health workers because for us, they are a key piece. And for me, this is because they teach one-on-one. Sometimes one is afraid of asking the doctor, and they can help or teach one-on-one, and that's invaluable. It's really invaluable. So we need to take advantage of community health workers, of their work, and take advantage that they can and are able to handle or navigate the system, and they can help other people navigate the system. They can be ambassadors, and they personalize education or customize education, and they help me that so that anything you want to say, they transform it and put it in simple words using popular education. That is the basic tool of community health workers, popular education. Why? Because not everything that we want to convey lands in the same way on every person. Each person has a different way to learn. Each community has important things that are different from other communities. So a single way, one size fits all of presenting messages doesn't work. That's why at MCN, we have been working, and that's my job. Part of it is to develop effective, appropriate materials. And this next part is going to be quick. You're going to have all the links so you can connect and see, look at all these materials that, from our perspective, connect with reality, value what people want. It presents practical solutions and they are clear and simple. So here you go. Some of the materials. These are related to respiratory health and climate change in English and in Spanish, and they're a tool for the community health worker or the doctor when they're in its office, right? During a visit, and they can provide this to their patient and talk about it in every visit. This is also a comic book that is called Adults Get Vaccinated to it. A lot of these migrants are here on their own without their family, and sometimes they neglect themselves a lot. But the characteristic of our materials is that they connect with reality of the people and what they value, in this case, family. And they are clear and they're simple. And they also provide practical solutions in simple language. If somebody doesn't understand written language, the image, the drawing, the picture can help a lot. Can you see? And this is the comic book about immunization and talks about each one of the vaccines when they are applied and where, all the details in the simplest way possible. And we already talked about community health workers. We already talked about community participation. We already talked about popular education. Now I'm going to talk about the last strategy, which is community engagement and participation, or community mobilization. So this basically is an approach where community health workers help the community network and prepare before a disaster.
Whenever there is a disaster. And these uh, strategies allow the central health to really reach the community. If there is a disaster, then the health center can also develop their own emergency plan, and the community can get ready and also assist the people who are more needed, the people who have chronic conditions, people who are any disability or mental health illness that does not allow to go out and seek for help. This is a very important this is a very important for us. The communication campaigns are very important. Um, for us, the communication campaigns need to be simple, small, tailored to the community, not for everyone. These types are less expensive, and then the health promoters can develop it. For the MCN, develop these materials. You can see here the the materials that is step by step. It has a methodology to develop education materials on all topics that you want in an easy and simple way. Why? Because we develop materials that are fully editable for health centers or for each organizations in different languages. You can, this is an example. You, this is an example of a COVID vaccination. But vaccination is a topic that we will be we will also be working. This campaign has also printed material, social media, uh, uh, videos, graphics, and everything uh, can be edited. There is a template, and you can include your logos and your own information. So here it is. This is an example of the templates. I want to stop on this. There are also videos on how to edit these resources. Here are some additional examples. So the interesting part of this is, for instance, the picture. These are pictures of the community itself. The health center can take pictures of their own community and can also make their own posters or their own materials. So there is a resource centers. I invite you to visit. And you can look at the topic that you are interested in, and you will be able to find all these resources that I'm showing you. For instance, there is trifolds, brochures, and you can edit and it can be edited both in English and Spanish. And there is a section where you can include the information of your organization, or you can just leave it and then you can insert any text that you want. These are other examples about vaccinations. This is another material on COVID for help for health workers. This is a calendar that comes with the comics for men. And well, we already saw all of this, but I want to close to give the opportunity if there is a question or a comment to summarize what we are promoting, what works to reach migrant communities is recognizing the process first, that it is not easy, that doesn't happen automatically, that we need to invest time to understand where we're going and who do we want to reach. It requires time to acknowledge the language and the value system. It requires time so we can know if we are promoting a health literacy, or if we are if we are blocking. There is a time also to develop culturally appropriate materials, to use community health workers in an optimal way. We need to involve the community so our plans or outreach plans doesn't consist in just giving a talk in a health fair, but that we go and we get involved with the community leaders, and they tell us where should we go and how we can reach the community. That's a very important community, and make them our allies. They already work with the community, so why we need to work to reinvent the wheel. For a summary, there is not just a magic formula to do this. We need to put our heads together and see how we can reach the people who who are difficult to reach by the organizations is sometimes it's hard, but it's essential to reach them. Those are the people that bring us the food, that grow our food, that makes this country a very rich country, as the U.S. is, because of the immigration and migrants. So now I want to see if there are questions or comments. Thank you. Thank you, Preciosa and Leo de Garcia. Karina,
Por favor,
thank
si
you.
tienen preguntas, ingrésenlo
Please, if you
en
have any
la caja
questions,
de chat
please,
o
you
en
can put it
Q&A.
in the chat or Q&A.
Gracias, Brenda. Gracias,
Thank you, Brenda.
Ana. Cari. Rebeca dice que le encantan los recursos de la página.
And Rebecca is saying that she loves resources.
Gracias, Alejandra. Paul.
Thank you, Alejandra and Paul.
Jorge. Jorge está hablando de que
Jorge is talking
definitivamente
about
es
that
muy
it is
importante
very
fortalecer la
important to
formación
strengthen
sobre los efectos de cambio climático y
the
los procesos de
train
formación de
education
la salud
on
pública.
the
Eso es muy
impacts
cierto.
of climate change
Una de las
in
cosas que
health, public health
veíamos es que
promotion. One of
desafortunadamente
the
hay
things that we
mucha
were looking into is
desinformación
that
y
unfortunately
mala
there
información
is
de las dos
disinformation
cosas.
and bad information.
Y necesitamos nosotros
So
estar al
we need
corriente
to
sobre las
be
cuestiones del
updated
cambio climático, la crisis
we need to
climática
be
e
up to date
informar
on
sin
the
asustar
climate
a la gente
change
y
crisis without
pensar
scaring people, but
en que tenemos enfrente de nosotros
think that we have
cosas
in
o
front of
dichos o
us
pensamientos como de
some
algo me voy a morir, las
they,
cosas no
they,
así
they
yo no las
say
puedo
that
cambiar.
I'm going to
Hay
die
muchos de
anyway.
esos
Things are like that.
valores que
There are many
están conectados que
values
tenemos
that are
nosotros que
against
luchar,
we need
informar,
we need to fight against, and we need
basado en
to
evidencia,
inform
buscando fuentes de
based on
información,
evidence.
hacerlo de
Look
manera
for
sencilla y
source of
accesible.
information. Do it in a simple way.
¿Hay alguna pregunta?
Any
Marta,
questions,
Leslie? Is there any question,
Martha or
Can
Leslie?
you see? ¿Cómo están adaptando la tecnología en este trabajo?
How
Hoy la
are you
gente
adapting
migrante
technology
usa
in this work?
celulares, consume redes,
Today, the
etcétera, de
migrants
inteligencia
use cell
artificial.
phones,
Completamente de acuerdo.
use
Sí, completamente de
networks,
acuerdo. Por eso
the
estamos,
social
por ejemplo,
media,
ahorita se utiliza más
and
el WhatsApp, se utiliza
I,
el TikTok, se
I
utiliza. Si usted
AI.
quiere
Yes,
llegar
now
a
we use
cierta comunidad,
TikTok and all
hay que
the social
utilizar y
media.
hacer
So
videitos.
if
Por
you
ejemplo,
want
para
to
salud
reach the
ocupacional
community, you
se
need to
usan
do like
videos
short videos
pequeñitos sobre cómo
for
protegerse,
um,
cómo usar el equipo de protección
for
personal,
workers,
qué le va a pasar
health.
después de que se vacuna.
Uh,
Son cosas
we
pequeñitas,
make
pero que es lo
videos,
que
you
la
know, how
gente
to
está
protect yourself in the
utilizando. Entonces,
workplace,
tenemos
about
que salir de la caja.
vaccination.
Tenemos que, como dice
We
usted,
need to think
aprovechar la
outside the box
inteligencia
and
artificial o la
also
tecnología.
take advantage of
Ahora,
technology and
mucha gente tiene
artificial
teléfono
intelligence.
inteligente, pero
Many
no
people
sabe
have
cómo
smartphones,
utilizarlo.
but they
Eso es
don't know how
parte.
to
También hay una
use it. So
división digital
that's
muy
also
grande.
there is
Entonces,
a
tenemos
a
que
huge digital
pensar
divide.
también en
So
eso.
we need to think as well.
Jorge Bernal
Jorge
dice,
Bernal is saying,
desafortunadamente muchas de las ferias de
unfortunately,
salud,
many of the
este
health
tema se
fairs,
deja a un lado.
this
El
topic
tema de
is
que, Jorge,
ignored.
el tema,
Which topic, Jorge?
si me dice de cuál tema, el
Which
tema de
topic
la
are you
educación a la
referring?
salud, el tema de los efectos del cambio
The
climático. Perfecto.
impacts of
Sí,
climate
tiene
change
toda la
on
razón.
health.
Tiene toda la
Yes,
razón porque
absolutely
no
right.
pensamos,
Yes, because we
lo
don't
vemos
think,
como algo que está
we
allá
see
o
it as
algo que
something
va
that
a
it is
suceder y no
far
podemos
away, that it is going
hacer
to happen,
nada al
and
respecto.
we can't
Tiene
do
toda la
anything
razón.
about. You're absolutely right.
Sería buena idea de lanzar la encuesta posterior.
No le escucho muy bien,
I
Marta.
couldn't hear you, Marta.
Yo le digo que sería buena idea lanzar la encuesta posterior, que fue la
So it will
pregunta.
be
De
it would
acuerdo.
be a good idea
Gracias por todos sus comentarios.
to
Bueno,
also
vamos a
the
seguir la
do the survey
conversación.
again. Thank you
Víctor,
for
claro
all
que
your
sí.
comments, Victor. Yes,
Usted
we will
trabaja en
continue
el
the
Departamento de
conversation.
Salud Pública.
Yes, you
Claro que
work
sí.
in the public
Cuando
health.
guste, aquí está mi
Whenever
correo
we
electrónico.
here is my
Y
email,
si no, a través
so
de Leslie también lo puede usted
or
hacer.
through Leslie,
Y
you can
bueno,
also
ya
reach me.
Marta está poniendo ahí
So Marta
el,
is also has
una
initiated
encuesta que nos
the
está
poll.
apareciendo. Por favor,
Please
respóndala.
answer.
Yo espero que esto haya sido,
I hope
que haya conectado
that
con ustedes, con sus
that this
experiencias.
presentation really connected with your
Gracias,
experiences.
Mari.
Entonces, respondiendo, Alma, si puede pasar por favor a la diapositiva.
If you can also
Esta.
advance
Sí, muchas
to
gracias.
this one. Yes.
Gracias, Yajaira.
Thank you, Jahaira.
Y en el chat está el enlace. Por favor, contéstenlo. Es importante. Porque sus opiniones y sus comentarios nos ayudan a
Yes,
mejorar.
because your opinions, your comments
A
help
todos
us
les
to
va a llegar
improve.
la presentación
So everyone will
en
get the
PDF,
presentation in PDF,
y les vamos a enviar también el
and we
enlace
will
a la
also be
grabación
sending
por
you
si
your
gustan
link
compartirlo con
for
sus
the recording
compañeros o
in
quieren
case you
verlo.
want to share it with your colleagues, or if you want to
Yo voy a cerrar la
if you want to
encuesta.
watch it
Gracias a
again.
todos.
And we need to do a survey. And thank you, everyone. Please.
Ade del Castillo dice que si vamos a ofrecer
Ade del Castillo is
créditos de
asking
educación continua
if
por
we will be
entrenamiento.
offering
Esa es su
continued
pregunta
education unit
para Leslie.
credit
Desafortunadamente para
for this
esta
training.
sesión
Unfortunately,
no
for
creo
this
que
training,
tenemos
I don't think we have
educación continua, desafortunadamente, pero sí les puedo enviar un
continued education,
certificado de
but I can send you a
finalización de
certificate
exitosa
of
si desea recibirlo.
attendance
De acuerdo.
if you
Y sí, y hay
if you
otros,
wish.
entren al sitio nuestro
Yes,
y
yes, go to our
enlácense con
website
nosotros y hay
and get
otros
get in
seminarios virtuales donde ofrecemos
connect with us.
100
We
minutos
have
gratuitos.
other webinars
Y
where
bueno,
we
con
offer
eso,
credits.
Alma, disculpa, pero ya
And I'm sorry,
se nos va
Alma.
la hora.
So
Quiero
the
decir,
I want to say
les quiero dar las gracias,
I
disculpa,
want to
a
thank
Leslie con
everyone,
Maine Primary Care
Leslie,
Association y a Maine Public Health
and
Association. Muchísimas gracias a nuestra
thank you
ponente Alma
so
Galván,
much
y
to
Roxana, quien
our
me ayudó con
presenters,
grabar la
Alma Galvan,
presentación en
Roxana,
inglés,
who helped me
y claro, a nuestros intérpretes,
to
Susana Cruz, de
record the
Integración
English, and of course our
Justicia
interpreters,
Lingüística.
Susana
Gracias a
and
todos
Susana,
ustedes.
for
Nos
the
vemos en la
dedication
próxima.
to language
Gracias.
justice. Thank you, and we'll
Muchas
see you
gracias.
next time. Thank you.